confirmed 81 new cases of COVID-19, bringing the total number of cases to 10,237. Of the new ones, 24 were in Seoul, 10 were in Gyeonggi-do province, and 7 were in Daegu. There were also 24 cases in people arriving from overseas. With 7 additional deaths, the death toll has now reached 184. 138 more people were discharged from hospitals. The total number of patients who've recovered now stands at 6,463. Let's cut over to the briefing and listen in.
Providing sign language translation. First of all, we will hear from Director General Yoon Tae-ho presenting. So it is April 5th Sunday, and I'll start the regular briefing. As of midnight of tonight, there are 3,591 people being treated for COVID-19, 6,463 people have been discharged, and 183 people have died. We have seen 81 additional confirmed cases yesterday, and unfortunately, we have seen 6 additional cases of death. We pay our respect to the deceased and we pay our condolences to the family members. So of the 81 additional confirmed cases, 41 occurred in Korea, and for those cases coming in from overseas, it amounted to 40. 24 were found in the quarantine office, and regional infection came from the regions, and this amounted to 16 cases. We held a meeting under the leadership of the Prime Minister, and we also talked about the preventive measures to have people not escape the self-isolation for those people coming in from overseas. And Prime Minister said that for those people who are violating the self-quarantine measures, they'll be penalized so that they have to pay under 10 million won or be imprisoned for 1 year or less if they were to violate the self-quarantine measures. And we also want to express our gratitude to the medical practitioners who are making full effort, and we also pay our respect to the one medical practitioner who passed away. And furthermore, we understand that there are people at the forefront making a lot of efforts, and we pay our respect and gratitude to them all as well. So we decided to lengthen the social distancing and strengthen it for another 2 weeks. So we want to be able to maintain it at a controllable level and to be at a maintainable level. And in order to do so, the decision was made to lengthen social distancing and strengthen measures. So we have seen that the level for which we can manage the path of the infection has been decreased to under 5%, and we want to be able to make sure that we can have our medical facilities be able to manage the treatments. So we have to make sure that we have enough preparations, and if we were to delay this, then it will be delayed for us to go back to our normal lives. So even if it is a bit difficult, we want to ask our citizens to comply with the strengthened measures and social distancing for another 2 weeks. For the next 2 weeks, religious facilities, sports facilities, and entertainment facilities where the infection can spread, we're going to have strengthened preventive measures applied to there. And we want to ask to strengthen the monitoring of those with high risk. So we are going to do so, for instance, for the medical facilities. And we're going to monitor everyone with symptoms on a daily basis. And once the reports are made, we're going to assess them based on the level of the illnesses, and based on it, we're going to have follow-up measures so that we can find those with symptoms and those with COVID-19 in the high-risk facilities at an early stage. So social distancing is the best way to prevent the further spread of COVID-19, and this is not found to be important only in Korea, but all across the world as well. It is important for us to comply with this so that it is protecting myself and my community and my family members. So we want to ask you to follow through with it. I will now explain about the measures for the medical practitioners. And we have seen 241 cases in the medical personnel, and this is around 2%. So 3 were exposed in the triage facilities, and there were 66 who were confirmed during the treatment of patients, and there were 32 who were found to be infected in the medical facilities, and etc. So we have not seen the cases being confirmed while treating those who have been confirmed with COVID-19. However, we are conducting further epidemiology research. So we're going to make efforts so that these people can work in a better environment. So during the diagnosis stage, we want to be able to minimize infection, and we have strengthened our measures focusing on those areas. So first of all, we're going to continue to strengthen the entry measures. So for those with just a flu or a mild symptom, we're going to have them use the untapped diagnosis. And for those with more severe illnesses, we're going to make them be tested before they come into the hospitals. And we're going to manage these strictly. And also, we're going to strengthen the preventive measures within the medical facilities. So for those with suspicious symptoms, we're going to monitor the travel histories, and we're going to use the necessary tools so that we can convey the necessary information to the medical facilities. And we're going to make sure that the protective gears can be sent to the necessary facilities as needed. And also in the triage facilities, we're going to make sure to minimize the time and space in which people come in contact with those confirmed. And in the facilities with those confirmed patients, we're going to make sure that a safe space can be secured. So we're going to make sure to follow these strict measures. And once the infection is found, we are going to make sure that we are treating them fully with our full efforts. And we're also going to strengthen our efforts. So for the hospitals, we're going to conduct consulting program. And for the small and medium-sized hospitals and for nursing homes, we're going to have the task force advisory forms so that we can have one-on-one counseling carried out for them. And also for the triage facilities and for medical hospitals, we're going to have training sessions, and we're going to have also separate training centers for the medical care centers as well. So until now, all of the medical practitioners and relevant personnel have been making full efforts, and we want to thank you once again. And we also want to ask our citizens to support these people as well. And also, when you are visiting hospitals, although it may be of inconvenience, we want to ask you to comply with all the measures so that we can protect ourselves and the patients. So we want to ask you to follow the guidances of the medical practitioners and the facilities. Now I'll explain about the people coming in from abroad. So starting on April 1st, we have decided to expand mandatory quarantine to everyone coming in from abroad. And it is more important than ever to follow these self-quarantine measures. So in order to prevent further outbreak of infection, we are monitoring those people coming in from abroad more strictly. So first, we are having the Central Disaster and Safety Countermeasures HQ monitor these people with the help of the municipal government. So if there are people who are violating the self-quarantine, we're going to have the public official in charge report of this, and we're going to have the punitive measures be taken to them. So recently there have been cases where people from another country have violated the laws and left their cell phones at home while leaving the self-quarantine facility. So we're going to make sure to take punitive measures in such cases. So for those people who are violating the laws, we're going to work in cooperation together with the municipal governments and the police offices. So we're going to monitor them, and we're going to have the residents report any of the cases. So we're going to monitor them more strictly from now on. So for those people who are violating the self-quarantine measures without real grounds, we're going to take punitive measures. So there could be damages claimed for them as well. And we're also going to have them excluded from the emergency fund support as well. And we have decided to strengthen the punitive measures. So if people were to violate these self-quarantine measures, they could be imprisoned for less than 1 year or be penalized with 10 million won or less. So we want to ask everyone to follow the self-quarantine measures as needed. So we are feeling the warmth of spring coming on. So we believe that our citizens probably feel really tired. However, if we were to loosen up on the social distancing, then all the achievements made by the government and citizens could come back to a blank slate. We cannot achieve this with our efforts alone, so we have to have concerted efforts. We want to ask you to remember this. So even as of now, there are people who are complying with social distancing despite all the inconveniences, and medical practitioners are also trying to overcome COVID-19, and many personnel and the many government officials are also making full effort to overcome COVID-19 as well. So instead of thinking that you yourself cannot make any difference, please make concerted effort to participate in the social distancing and the strengthening measures. So we want to ask our citizens to participate in this effort together with the preventive HQ so that we can overcome the COVID-19 situation in Korea.
And that'll conclude our coverage of this briefing, but stay tuned to Arirang for the latest on the coronavirus outbreak in South Korea. We'll be back at the top of the hour.
The number of confirmed cases in Korea exceeded 9,300. The number of those fully recovered and released eclipsed 4,500. Guiding principles of our approach: 4 key concepts: speed,